Good afternoon, everybody. Good afternoon. It's another nice day, a good day to get outside, take a walk, get a breath of fresh air. Thank you for continuing to tune in today at 1 o'clock. We'll be back tomorrow and the next day at 1 o'clock as well. And we're going to do our best to keep you informed and make sure you have everything you need to know as we enter into this next phase of dealing with the coronavirus here in Rhode Island. We'll start, as we always do, putting the data up on the screen. As you can see from the data, today we are reporting another 325 cases. You know, we wish it were lower. As I keep saying, we wish the number were going down. However, this, which is a bit of a bump, we think it should not alarm you. We think it's a reflection of the fact that we are now making a big effort to test many at-risk communities. So, as I said yesterday, between now and Monday, we want to hit every nursing home. We are now in a lot of urban communities, highly densely populated communities. Every nursing home. So we believe that this increase is a reflection of where we are doing the testing. And frankly, if anything, it's in some ways good news, because the fact is that we are getting into those communities, which is exactly where we need to be with our testing. Okay, today I want to focus my comments on the entering phase 1 of our reopening our economy. And I have spent a lot of time over the past week and a half talking about the overall approach for this. My goal is to get as many people back to work as quickly as possible without ever jeopardizing our public health and without ever having to go backwards to where we've just come from, which is shutting down our economy. So what does that mean? It means we have to be smart about it, we have to be thoughtful, and we have to go slow. If we have learned as a nation, as a state, as a nation, as a world, one thing about this virus is that if you stay ahead of it, if you stay ahead of the curve, then you can control its spread and you can go about your life. You can go to work, you can go to school, you can do what you need to do. But if it gets ahead of you, if you have uncontrollable outbreaks, if the spread starts to snowball, then that's when you get into trouble. So to that end, what we're going to start doing now is testing our systems. We've all developed new ways of living and going about our business. We all now know how important it is to wash our hands and stay 6 feet apart and wear our masks. We all have become much more aware of what's necessary to keep ourselves safe. And I think we all know how horrible the consequences are of trying to break the rules. So I feel that I am leading from a position of confidence and strength, and quite frankly, trust in the people of Rhode Island. I am trusting that people are going to do the right thing and use good judgment. I'm not going to be able to, we're not going to be able to enforce every bit of everyone's human behavior in the weeks and months to come. But we are all in the same boat here. If we think we're outfoxing the disease and we're going to start to try to push the limits, go faster than we should, we're all going to get in trouble. We're all going to go backwards. So let's just all do the right thing. We've learned together what that means. We're going to use common sense and good judgment, care and concern for our neighbor. We're going to start slow. We're going to gain speed. And over the next few weeks and months, we're going to get right back to where we wanted to be. So a week and a half ago, I set forth the triggers. And I want to take a second to go through that. I'll start the conference by saying, everyone keeps saying to me, Gov, are we going to lift the stay-at-home order on Saturday? The answer is yes. I'm very proud to say, because of your hard work, we're going to lift this stay-at-home order, and I'm going to let that executive order expire, and I'm not extending it. Because of your hard work. Why am I doing that? Because we've met all of the triggers such that we can do that safely. So what are they? Number one, we said there had to be a 14-day downward trend in cases or a 14-day stable trend in hospitalizations. So, as I said, to determine this, we want to look at an average. We're talking about trends. We're not talking about any particular day or point in time. So what we have been looking at and tracking is a 3-day moving average now versus a 3-day moving average 14 days ago. Case numbers will fluctuate day to day, so that's why we're not looking day to day. So I'm going to tell you we've hit the mark. For new hospital admissions, our current 3-day moving average shows a decrease of 5 new admissions per day compared to that of 14 days ago. So that's a 15% decrease in the number of new hospitalizations. For new cases, our 3-day moving average compared to that of 14 days ago shows a decrease of 95 cases per day. So that's a 25% drop in the new case trend over the last 2 weeks, over the last 14 days. So what that means is we're meeting both metrics on the declining trend in cases and the flat or declining trend in hospitalizations. We're also tracking, a lot of you have said to me, how do you account for the fact that some days you test more, some days you test fewer people? When it rains out, we test fewer people. We're keeping track of the percent positive, which accounts for how many tests we do, and that is trending down very nicely over the past 14 days. So we checked that, we cleared that hurdle. Second, we said we must be able to test all symptomatic people who feel sick, within 48 to 72 hours. As I explained in detail yesterday, at this point, nearly all symptomatic people are able to receive a same-day test, and for the most part, people are getting the results back within a day or two. There's still a few cases where it takes 2-3 days, but that's still within the 72-hour metric, and we're working hard to get that timeline down. So check mark on that. Third, we said we needed to ensure that all Rhode Island communities, particularly those that have been disproportionately impacted or are most vulnerable, have access to testing. And as I mentioned yesterday, we've made huge progress on this score, and we're continuing to add new sites and mobile testing regularly. So I am confident where we are in meeting this metric. We have walk-through sites in communities in Oneyville, Pawtucket, Central Falls, Woonsocket, East Providence, Newport, other places. We have new rapid testing site in Central Falls. We have mobile testing at nursing homes and hotspots. So I feel that we can check that box. Also, was asked yesterday about the White House and such. I should reassure you that this morning, Dr. Alexander Scott and I had a call with Dr. Deborah Birx. She reviewed where we are. She reviewed our testing protocol, and she, frankly, was very complimentary on where Rhode Island is with respect to its system, its cases, and also our testing and our testing protocol, and pledged support to continue to help us further expand the way we do our testing. Fourth, they said we needed to ensure that the vast majority of contact tracing is done within 48 hours. I want you to know that currently we're reaching out to over 90% of all contacts within the first 24 hours, the vast majority of whom are responding and sharing their information. So we've cleared that hurdle. Fifth, we said we needed to meet the overwhelming majority of needs for those in quarantine and isolation. I spoke on Tuesday about the structures we have in place to accomplish this. Our food distribution services, over 1,200 beds at 6 different sites to house folks in quarantine and isolation, and technology to connect anyone in quarantine with needed services. So I feel that we've cleared that hurdle and have confidence in that. Sixth, we said we had to have at least 30% of ICU beds open and a sufficient amount of personal protective equipment. At this point in time, we have 35% of our ICU beds available in our existing hospitals within their current operating capacity. In addition, each hospital has a surge plan in place, which they could activate at a moment's notice, and we have our field hospitals. So we've cleared that hurdle. We also have on hand enough surgical masks, face shields to last more than a month, and the same for enough N95s and gloves to last several weeks. We also have the Battelle system fully operational, which allows us to sanitize and safely reuse the masks and PPE. And we're still working quite literally 24/7 to continue to shore up our PPE supply chain. In the spirit of full disclosure, we continue to struggle a little bit with gowns. For whatever reason, there's a global shortage of gowns. However, we have procured locally from a great company in Fall River, and so we have excellent visibility into where we're going to get thousands of gowns very soon. So overall, I feel very confident in our systems for PPE. Seventh, we said we needed appropriate workplace guidance and regulations so folks could get back to work and know how to do that safely. Yesterday, I spoke roughly about what we'll be requiring of all employers, with screening of employees of symptoms, make sure they're not sick when they go to the office, sending employees home if they're sick, cleaning daily, etc. As of now, we have business guidance and regulations published on reopeningri.com, and we will continue to add sector by sector guidance. Finally, I said we needed to be prepared to use a data-based approach to determine if we needed to reimpose any measures. Essentially a warning system if we get into trouble again. How do we know? How do we know in advance? And what do we do? And as I explained yesterday, we're in the process of rolling out an early warning system with testing. We're in the process of rolling out technology around symptom monitoring. And so we are, very definitely, and we check the data every day. We have robust data gathering from our hospitals every day in real time. And so I feel that we have the systems in place to move forward with phase 1. I want to take a moment to thank all of the unbelievably hardworking members of my team, state employees, mayors, town managers, local first responders, everyone who works in a hospital, folks at the nursing home, General Callahan, and the troops at the National Guard. The list goes on and on. Essentially, I just laid out for you the fact that we have utterly rebuilt a system from scratch to enable us to go back to work safely and give you confidence. The thing I want to convey to Rhode Island is you should start to regain your confidence. I just went through in great detail why it is that on Saturday we get to enter phase one. We get to start going back out to retail. We get to begin our lives again and get people back to work. The reason for that is because we've had literally thousands of people working 7 days a week for the past 8 weeks to make these systems as strong as they are. And also we have 1 million Rhode Islanders who are doing the right thing. So if that continues to happen, and it will, you should have confidence that when we go into phase one and eventually into phase two, that it's safe to go ahead and do that. So let me take a second about reminding you what phase one should look like. We'll be lifting the stay-at-home order and officially beginning phase one on Saturday. What's it going to look like? Frankly, not very different than it looks right now. If you're working from home, you need to still work from home. If you can work from home, work from home. We're still not going to be able to congregate. We still have to keep 6 feet apart from one another. It won't be visibly much different. It's absolutely not time to expand your social network. This is not the time for social gatherings. My focus is to get people back to work. The economic devastation in this state and every state around the country is untenable. So I am focused like a laser on work, getting people enabled to work. And so in order to do that, we're going to keep social gatherings to a minimum, and we're going to let folks get back to work. So as a reminder, in phase one, non-critical retail stores can reopen with capacity limits. So that means if they're ready on Saturday, they can go ahead and open. All the new limits are online, reopeningri.com. And all of us, just be careful. Just be careful. Wear your mask. Stay away from other folks. Don't wait close to each other in line. Don't crowd. Limit your browsing. But go ahead. Get back out there. We need to stimulate this economy. So if you can, get out there and do a little bit of safe shopping. Anyone who's deferred healthcare needs, it's time to call your doctor and go ahead and go see your doctor if that's what your doctor recommends. Telehealth is still fully available. It is working well. It is often the best option. We don't want to be going out if we don't have to. But if you need to get an immunization, if your doctor says that he or she wants to see you, it's okay. It's time to start doing that. We're also going to be hospitals will be returning to the business of providing required but non-emergency medical procedures. They're going to start resuming them. So hospitals, to their great credit, had stopped many of the non-critical surgeries, non-critical procedures. But starting next week, they're going to start getting back into that business. And by the way, I know there's a lot of Rhode Islanders out there who've endured inconvenience, pain. It's been hard by putting off your procedures because we were getting our hospitals ready. So I want to thank you for being patient, and I want to thank our hospitals for being cooperative. Every hospital has submitted to the Department of Health an extensive plan for how they can safely reopen and expand their services. I want to really hammer that home. These plans are extensive new protocols around testing, mask wearing, infection control. These hospitals would not be reopening if they didn't think it were 100% safe to do so. All of the plans have been approved after a thorough vetting by the Department of Health. South County Hospital began earlier this week with some of these elective procedures. Other hospitals, including Lifespan, Care New England, and Charter Care, are moving forward, making these procedures available starting on Monday of next week. Westerly Hospital would like to begin on May 13th. Now they're going to go slowly they're going to go cautiously. They will be in touch with you through their own systems to start the scheduling. But it's time. It's time to do this. And I just want you to have the confidence to know that if you get called and if they want to reschedule a procedure, a test, a surgery, you ought to go ahead and do it. I also want to say, I hope that this unlocks a lot of employment. Hospitals have had to reduce their employment, put folks on part-time, put folks on furlough, and it's my hope that when they start getting back into business, you will also get your jobs back. As I said, for offices, everyone who can work from home in phase 1 should work from home. Offices are permitted to start allowing folks back on a limited basis and for a limited period of time as necessary. And those guidelines are also on reopeningri.com. We're going to have more options to go outside. Go to the DEM website, and there's a list of state parks which will be reopening with limited parking starting on Saturday and over the weekend. So that'll be nice to be able to drive to a park and go there. And again, but don't go to the park and congregate, because we all know that that's what causes troubles. Okay, as I said, in the first phase, we want to keep our network small. By now, we've all gotten into the habit of writing down every day who we've been with and where we've been, and we've been trying to limit our exposure to the same 5 people. And that's really what we should continue to do. Keep a log, keep your network small. And this is hard. You know, like we miss being with our family. We were without our family for Easter and Passover. We're going to be without our family for Mother's Day. We don't get to hang out with our friends. Our kids can't hang out with their friends. We can't say, it's a beautiful day, let's come over for a barbecue. And that's hard for all of us. But if we're going to focus on getting people back to work and doing that safely and taking this slow and steady, we're going to have to wait a little bit longer before we can start getting together with our friends and family. So when the stay-at-home order lifts tomorrow, social gatherings will remain limited to 5 people. Why did I choose 5 and not 10? A few reasons. 1, we're focusing on work, and in order to enable safe work, we need to keep our social gatherings small. 2, we're ahead now of Massachusetts and Connecticut. They both still have stay-at-home orders in place. So it just felt prudent that we would lift our stay-at-home order, go ahead and get back to work, but keep social gatherings to 5. Also, through my regular contact with mayors, I think it's fair to say that they're worried about social gatherings, and it's a challenge for them to enforce limited social gatherings. So they worry that on a beautiful day, you will very quickly see 10 or 15 people congregating in a park, 10 or 15 people at a family barbecue, 20, 25 people at a backyard event, and we really don't want that. We cannot handle that right now. So the social gathering limit remains at 5 in phase 1, and we are going to enforce that. Tomorrow, I'll be issuing a new executive order to extend the ban on social gatherings of 5 people until May 22nd. We'll have a look at it again at May 22nd, and I'm really hoping and expecting we'll be able to lift it then. So it's just a couple more weeks, and I feel after great consideration it's the right thing to do. Also, we have to remember we're still stuck in between these 2 hotspots of New York and Boston, and we have to play it safe, is how I felt. Okay, in addition, the following orders will extend through May 22nd. Domestic travel. Anyone coming to Rhode Island from any other state for a non-work related purpose by any mode of transportation must self-quarantine for 14 days. We've made a slight change on these regulations. The restriction is not going to apply to anyone traveling to another state and coming here for medical treatment or to obtain necessities like groceries, gas, or medication. So for a while, there was a lot of confusion. If you live in East Providence and you want to go to Seekonk to go to the doctor or what not, could you come back here and not be in quarantine? The answer is yes. You do not have to quarantine when you come home. Restaurant dine-in. Restaurants, bars, and cafes will unfortunately remain closed to dine-in service for phase one. It is really my hope that later in phase one, we can allow restaurants to add limited outdoor dining. And we're working super hard on that to enable that as quickly as possible. Look, this industry has been crushed all over the country, and we have to focus on helping them get back to work. In the meantime, we're going to make one small change, hoping to help them out a bit, which is wine and beer will still be able to be sold with takeout orders. In addition, starting this Saturday, we're also going to allow restaurants and bars to sell mixed drinks with takeout in sealed containers. I know it's not much, but it's something. It'll tide you over a bit longer until we can get you to outdoor dining and then indoor dining. By the way, if you can, do takeout. Leave a big tip, order a few drinks, spend some money, help these guys out. If you can't, I understand that, but if you can, now's the time. Business closures, recreation and entertainment businesses will remain closed. So that would be movie theaters, cinemas, bowling alleys, concert venues, museums and zoos, and close in contact businesses, gyms, hair salons, nail salons, barbershops, tattoo parlors, will also remain closed for now. So let me say a few things. We are going to endeavor to put all information on reopeningri.com. So if you have a question, what about me? What about this? reopeningri.com. If you can't find it there, you can go to the DBR website if it's a business. But we're going to really try to do our best to have everything on reopeningri.com. It is impossible for me to stand up here and go through every what if. For example, golf courses. We never closed golf courses, but starting in phase one, we're going to relax some of those requirements. You can go back to using carts as long as they're cleaned every day and it's one person to a cart. So that's going to be on reopeningri.com. We're going to continue to relax restrictions. We already opened garden centers. Manufacturing never closed. Construction never closed. So what I can say is, if you're a small business, or if you're a Rhode Islander wondering, can I go play golf? Can I go to the park? Go check out reopeningri.com. Ultimately, at the end of the day, just remember the gold standard. Don't leave your house if you're feeling sick. If you are, call your doctor so you can get a test. Put your face mask on. And keep yourself away from people, minimum of 6 feet. Going forward, I'm going to be reevaluating everything really every day and every week looking at how are we doing. And every week I'll come back on a weekly basis. Okay, how are we doing? Can we speed up? Will we slow down? So these are the guidelines as they are now. If you're a particular business, reopeningri.com will have more information. But we're looking to get folks back to work. So we're working very hard right now to enable outdoor dining. We're looking very hard right now to enable some other businesses. And by the way, I want to thank all the businesses who are collaborating with us. And I feel confident that we're going to really be able to get to a good place if we take it slow. A couple of other things. The following executive orders are expiring, and I am extending them to June 5th. Number one, anyone coming to Rhode Island from outside of the country must self-quarantine for 14 days. Number two, anyone who's been diagnosed with coronavirus by a lab test or by a doctor must isolate until they're cleared based on the Department of Health guidance. If you don't have the symptoms, but you've been in close contact with someone who has the symptoms, you also must quarantine for 14 days. With respect to gun permits, I'm also extending that order until June 5th. In keeping with the request from the Rhode Island Police Chiefs Association, we've extended the time period that law enforcement has to complete a background check from 7 days to 30 days. I'm also extending until June 5th the telehealth executive orders. Health insurers must cover telemedicine for primary care, specialty care, and mental health and behavioral care, basically everything. In addition, we've also ordered some of the burdensome regulations around referrals, network changes, medication coverage, and prior authorizations that can stand in the way of getting care. Those have all been relaxed, and that's extended until June 5th. I want to make a note about churches. Some of the hardest part about this for us has not being able to go to church or synagogue or celebrate and worship with our faith congregations. So in light of that, in phase 1, we'll be allowing places of worship to reopen for groups of 5 or fewer. So what that means is if you want to have a religious service in house of worship with a couple of people and a videographer, and then stream that service, that's perfectly acceptable. And we've had that request from a number of people. So if you'd like to be there with a cantor or an altar server, videographer, a few people, and stream that out, we encourage that. Obviously, we're also allowing and encouraging drive-in services as long as folks stay in the car. We're also going to be allowing in phase 1 funerals to have a maximum of 10 people, as long as the 10 people are appropriately socially distanced. Same thing, we've been working hand in glove hard with members of the faith community. By tomorrow at reopeningri.com, we'll have all the details about faith-based communities. Okay, I think that is a wrap for now. As it will say, information is the name of the game, and as is two-way dialogue. So there's an opportunity on reopeningri.com for us to hear from you. So we have set up a business advisory board. We're working closely with hospitals, working closely with municipal leaders, working closely with nursing homes. But we want to hear from individuals too. Life's tough out there right now. So let us know your ideas and how we can help you. And we're going to do everything we can to support you as best we can. The first question will be, how long will we be in phase 1? The answer is I don't know. Next week, I'm going to devote a whole day to explaining the triggers for how we get out of phase 1 and go to phase 2. I'm also going to be explaining how we're going to think about when we might have to go backwards. I will say this, it's the hope that it won't be very long, right? The hope is that we have another 14 days of a great experience. Stabilization, everyone continues to do what they're doing, cases are flat or down for 14 days, then we can have real confidence to keep moving. So that's why I say if you can hang in just a bit longer, I do feel like there's real light at the end of the tunnel. So with that, I'm going to turn it over to Dr. Alexander Scott and then come back.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I want to join with the Governor in expressing our appreciation and trust of you as Rhode Islanders in taking this information and implementing it, complying with the rules going forward in a way that will allow us to continue in the path that we're going. As the Director of Health and as a physician and an adult and pediatric infectious disease doctor, I've wanted to make sure that you have the science and the information so that you have an understanding of why we are saying it's important to keep your network small. It's important to be able to stay 6 feet apart from people who are not from your own household. It's important to be able to wear some form of cloth face covering, all of which is to stop the virus from spreading, because you all have learned the virus spreads most easily when you're in close distance to each other in crowds and not washing your hands and spreading illness, whether or not you may have symptoms. So we are confident that you will be able to follow this in a way that allows us to continue to turn the dial slowly without seeing as many changes in the cases and the data. So let's jump into the data. We have 325 new COVID-19 cases to announce today. There are 318 people currently hospitalized. Of those people, 82 are currently in the intensive care unit in the hospital, and 56 of those 82 people in the ICU are on ventilators. We are very sad to report that we have 18 new COVID-19 associated fatalities. These people ranged from being in their 60s to being older than 100 years old. Of these people who have passed away, 14 lived in long-term care facilities. Sadly, 2 of these people were residents at the Rhode Island Veterans Home. Both of these residents at the Vets Home were in their 70s and had underlying health issues, 2 of the unfortunate risks that lead to bad outcomes with COVID-19. The administrators at the Vets Home and the Rhode Island National Guard, along with the Rhode Island Department of Health, all have taken a very comprehensive approach to responding to the cases that have been identified there as a result of aggressive testing of residents and staff. The same comprehensive and aggressive approach that I've shared with you that we're doing across all of our nursing homes and aim to do with all congregate care settings. Those steps have included cohorting of patients, bringing the patients who have COVID-19 into one area and the patients who don't into another area. Aggressive symptom monitoring, so making sure that any staff who enter and during their shift are constantly checked for symptoms so that they can leave if symptoms develop, as well as making sure that masking occurs throughout and there is regular, thorough environmental cleaning. But sadly, as we're seeing in other nursing home facilities, in spite of these aggressive and comprehensive approaches, these 2 people in the Vets Home were lost. I want to add that while we honor and remember the veterans from the Vets Home, there are veterans who live at and get care at other long-term care facilities throughout Rhode Island. We want to be sure to recognize and honor all veterans in the state and thank all the facilities that are providing them with the accommodations and care in Rhode Island that they deserve. This certainly has been a challenging time for our long-term care facility community. The numbers change day by day, but around 70% of our fatalities have been associated with long-term care facilities. A lot of people have asked us questions because they've compared that figure to the percentage in other states of fatalities that have been associated with long-term care facilities. I want to add one bit of context so that we can look at the full picture as well. Rhode Island's overall fatality rate for COVID-19 associated deaths is actually a little lower than the rates in some of our neighboring states like New York, Massachusetts, and Connecticut. People who live in congregate care settings in all these states and in Rhode Island are at an elevated risk for negative outcomes, as we've discussed. But the fact that Rhode Island has a lower overall fatality rate than some of our neighboring states can make it such that the proportion of our fatalities that are in congregate settings seem a little bit higher, relatively speaking. We have a lower number overall and more people in nursing homes of an older age. And so that relatively speaking, to why that 70% of fatalities and more associated with long-term care facilities is occurring in Rhode Island. So that relatively speaking, as I've said in the past, Rhode Island has a population with many beloved older adults is occurring in Rhode Island. This context, as I've said, the challenges faced by congregate settings and more vulnerable populations in Rhode Island are similar to the challenges in other states across the country. Each time even just one person passes away, it matters. They're more than just a number, they're a human being that we all care about. I also want to repeat that the staff at nursing homes and the administrators in Rhode Island are enormously committed to the health and safety of their residents. They are those residents' second family members. Making a home for these residents is sacred work. They're residents, not just patients. And it's something that staff and administrators take very seriously. We are working with them to support residents and support families during this enormously challenging time. So with that, I will pass things over to Margie and the governor for us to get started with questions.
Good afternoon. Thank you. We're going to begin with Alex Weldon from WPRO. Governor, he asks, what is the constitutional footing for delegating mask fining to the Department of Health?
Yep. So most of the executive orders are done pursuant to Article 9 of the Rhode Island Constitution, which gives the governor broad authority in the state of emergency like we're in now. And it's not that unusual for the Department of Health to issue regulations of this kind as they combat this kind of a serious public health emergency.
Our next question is from Stephen Triedman of Eastside Monthly. We've heard from a number of small fitness, Pilates, spinning, and yoga studios that fall under the large gym umbrella and remain closed. They are desperate to reopen to survive and have asked if there could be a sub-classification in the gym category that would allow them to open sooner.
It's a great question and literally something we've been working on today. The answer is yes. We're trying to figure it out. I don't have something to tell you now. As of phase 1, they're still closed. The official guidance is no change on Saturday. However, I understand what you're saying, and we're working very hard to try to figure out which subset, how to define it, under which safety guidance. And actually, we're in discussion with a number of folks who own those sorts of studios. So as I said 10 minutes ago, we're going to continue to have updated guidance. Maybe I'll have an announcement on that in a week or so. And we're trying to get there.
Bill Bartholomew has the next question. Governor, some restaurants in Providence have announced that they are not going to open during phase 1, citing risks to guests and staff. Are you counting on individual business owners to assess that risk, or would you prefer a more unified approach within industries and sectors that is driven by your decision?
You know, it's an excellent question. Look, at the end of the day, I can't force somebody to open. If they just don't feel safe, then I understand that, and they're gonna do what they think is right for them and their employees and their customers, and I absolutely respect that. Having said that, there's a lot of people out of work right now, and we're doing a huge amount of analysis, taking it slow, making sure it's safe, giving extra guidance. So what I would say to them is, and I'm going to say this to everybody, I know you're afraid. I understand that. But we do have, as long as we go slow, remember, our goal is don't let the virus get ahead of us. But if we go slow and follow the new rules, we got to get back out there. We have to be brave. Smart, follow the rules, but brave. And so that means getting back out there. So in phase one, restaurants are closed anyway for in-room dining. But and again, I'll never force any in particular business to do what they think is not in their interest. But what I can say is when the time comes to open for in-room dining, we're going to give you our best advice and we think it's safe. And so you probably ought to do that.
Michael Bilo of Motif Magazine says small businesses approved for PPP have a June 30th expiration deadline without congressional action, but don't know to what extent they can reopen by then. What is your best estimate of what July might look like for bars and dine-in restaurants? Could they be at full capacity?
It's possible. You know, it's impossible for me to say the first week of May what the last week of July is going to look like. This thing changes daily and weekly. I think it's probably unlikely, but I don't know. Look, listen, our goal, it all depends on our experience. And that's why in the beginning, we really want to take it slow. If the experience is such that when we're all going out and restaurants are at 50% capacity and we're not seeing an increase, then it'll give us confidence to relax. But it's just, I can't honestly give you an estimate now because candidly, it depends what things look like in a month from now.
Continuing the theme, Ted Nisi of WPRI 12 says some business owners say they want to start reopening in phase one, but claim their employees say they won't come back because they're making more money on unemployment. Is that allowed? And what should employers do in this situation?
It's an issue. I'm going to say that is a real issue. I want to be careful here because I am so deeply grateful to the United States Congress and our congressional delegation for moving quickly to expand unemployment insurance. It was the right thing to do, and it is saving Rhode Island. On the flip side, the additional $600 check, which was well intended, is, that's a factor. It's relating to what you say. Now, it does expire. So definitely when that goes away, that calculation will change for people. Here's what I would say, and this is what I would say. Do the right thing. Like it does frustrate me that, this was an initiative intended to help people get back on their feet. It was not an initiative for folks to make more staying home, and then that hurts their business. That was never the intent. In the long run, you're going to want your job to be there. So if your employer is reopening, I'd encourage you to work with your employer and get your job back. And there's only so much that we can do. What we are trying to do is help businesses find employees. So we're using Skills for Rhode Island's Future. We're doing a lot of matching. We're trying to train employees and work with employers. But I can't deny that what you say is a fact, and it's what's happening in the labor market. By the way, not just in Rhode Island, it's happening in America.
Steve Alquist of Uprise RI has a question posed to both the governor and Dr. Alexander Scott. What kind of guidance are you getting from the Commission on Health Advocacy and Equity, established to advise you on racial, ethnic, cultural, and socioeconomic health disparities on your reopening plans?
I very much appreciate that question, Steve. Our leaders in our RIDO Health Equity Institute are working very closely with the leaders of the Commission on Health Advocacy and Equity so that we can assess together ways to place a racial and equity lens onto every element of our reopening. When the governor walked through the triggers, for example, for moving into phase one, it was that effort that helped lead to why one of them includes making sure we have the capacity needed in our communities disproportionately impacted by COVID-19. We also want to continue to work together on how we can incorporate that lens into our reopening. We've already begun thinking about how to make sure businesses within communities hardest hit are able to participate and engage with us in the reopening process. And we'll want the Commission for Health Advocacy and Equity to continue to hold us accountable, knowing how critical it is to make sure that on the other side of this, we have communities in every zip code in Rhode Island who has bounced forward to be stronger, more economically resilient at the end of this pandemic so that we can all be prepared going forward together.
Christian Winthrop from Newport Buzz asked you, Dr. Alexander Scott, how many travelers entering Rhode Island on the mandatory 14-day quarantine have tested positive for COVID-19?
That's a great question. It's similar to the one that was asked yesterday about how many out-of-state visitors were hospitalized. That's data we are still culling. We haven't forgotten about that question. It requires us to go back through every single hospitalization and now case to help understand that. But my understanding, particularly for those who have traveled and needed to quarantine, that number is relatively low. The quarantining process is a critical one. It allows us to help make sure that someone can monitor at home, not in the public setting, for symptoms to develop, and then we can work towards getting them tested. So the number that we will have, which we'll work towards obtaining, would be among people who were unlikely to transmit the virus to another person because they were following the process appropriately, and that at all times is the key. We want to make sure that someone does not transmit COVID-19 to the next individual by doing the social distancing, wearing the masks, quarantining upon return from travel, and washing your hands regularly.
Governor Doug Lizette has another question about gyms. When will they be able to reopen, and what rules do you expect they'll need to follow?
So gyms, we're targeting for phase 2. It's a little bit more complicated, obviously, with equipment and sanitizing the equipment. As I said, in an ideal world, we think phase 2 will be about 14 days, from phase 1. And what rules will they follow? I don't now know. We're still working on that guidance, but it'll be, much as you would expect: more social distancing, limited capacity, perhaps limits on the number of people who could be in the gym at any one time, extreme cleaning protocols, etc.
John DePietro asks, can churches open Sunday for Mass on Mother's Day? Why not let churches conduct Mass outside or by using spacing in the pews? Why don't you consider church an essential business? And lastly, faith is not a social gathering.
Yeah, so it's a good question. Like I said, we've been talking an awful lot to all faith leaders. I've decided to go for now with the five people. So you could have 5 people in a church or synagogue and broadcast that. You can certainly do, lots of folks are doing the drive-through services, and something more will come soon. But everything I know says take it slow. It is so much better to go slow and gear up than to go too fast and pull back. So if that means waiting another couple of weeks, as hard as that is, I have decided, in consultation with many leaders in faith communities, that that's probably the right way to go.
As Dr. Alexander Scott mentioned earlier, and this is Tim White's comment, 2 residents at the Veterans Home who have tested positive for COVID-19 have died. Staff members have told us there is a shortage of workers and PPE there. What is your understanding of resources at the home right now?
Yeah, it's definitely a place where we are focused in terms of making sure that the adequate PPE is there and that we're responding to the staffing needs. Sometimes it can happen quickly and the message can come through that someone isn't available to come in for their shift, but then work is done in collaboration and they're able to address that. So that's something that we're in constant communication with the Vets Home about, as well as the other nursing facilities, to help support them in coming up with the solutions for stable staffing. And I really credit our team that the governor referenced earlier in helping to make sure that we have personal protective equipment as a state. Our priority is the healthcare workers in hospitals as well as in our congregate care setting nursing homes. So they know, and we are very quick to respond whenever additional PPE is needed. that we get it to them. So that's been our focus.
Elizabeth McNamara asks, the 10,530 cases of COVID-19, are they all test-confirmed cases? Is there any use of presumed positive COVID cases on the data dashboard?
So yes, Elizabeth, these are the 10,530 cases that we have tested that we know of. And it's really important to use that message to say if there's anyone out there with symptoms of any kind, knowing that it can be a wide variety of symptoms for COVID-19, please do not hesitate to get tested so that we can support you. That is when the test works the best. That message stays the same. When you have symptoms and you get tested, that gives us the most accurate results for being able to respond and help you get isolated and your contacts get quarantined and stop spread of the virus to other people, knowingly or unknowingly. There's no longer a reference to presumed positives for cases. That was early on. Our state health laboratories have done the validation processes immediately, very early on, and every case that we have is a positive case based on our laboratories' identification of it.
Nancy Thomas of RI News Today has a similar note and also question. We hear every day about specific problems at the Veterans Home as we see a consistent majority of deaths each day happening in nursing homes and group homes. What whole system change is being looked at to stop the steady tragedy of 10 to 20 deaths a day continuing?
It's an excellent question, Nancy, and something that we are addressing on a daily basis. We had even an extensive discussion with the governor today. There are always components of addressing what's urgent now and helping to make sure system-wide that there is workforce stabilization. I've shared some of the policies and regulations that we removed barriers so that we can get people into the workforce to be able to support. I want to continue to encourage anyone who's taken advantage of those opportunities to show up and help us in shoring up the workforce in our nursing home settings. We also are going in to make sure they have the infection control support, the PPE support, and what's needed to address the immediate. We also want to look forward to seeing how the stabilization can occur at a system-wide level for the long term in Rhode Island. As COVID-19 is here, this is something that's critical because we have a medically and physically fragile community in a congregate setting. So we want to apply all of the elements of what we're doing for the immediate and the long term to help make sure that we have a system-wide response and helps address this ongoing challenge.
Our last question today is from Mary McDonald at the Providence Business News. Several rural communities and zip codes are showing a high rate of infection. Greenville and Burrville, for example. What's the cause of this?
This is a message that we've relayed early on. COVID-19 is not looking to only occur in certain areas. It does not care about borders between cities or towns. It does look towards people who are older or who have underlying illnesses and communities that may be more vulnerable to that because of challenges within their communities that we need to address. But we are seeing COVID-19 impact people of all ages and in every zip code and in all communities. So we want to continue to place a lens on each community, help understand what's needed, make sure that access to testing is there and the services are there for each community. And it's why we are sharing the data as well on zip codes so that we can partner together on being able to address that and help keep our hands wrapped around COVID-19 as a state in Rhode Island.
Thank you, Doctor. Take care, Governor.
conference leader. Please hold for the 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 conference leader. This conference is in silent mode.
Hi, everyone. This is Jen Bogdan. We're here with the governor, Dr. Alexander Scott, and Director Smiley. We'll take your follow-up questions.
The conference is now in talk mode.
Governor, this is Steph Machado. On the Reopening RI website, it says non-critical retail establishments can open on May 11th, but you just said in your press conference that they can open Saturday. So
Yeah. I'm sorry. The website's wrong. It's Saturday, and we're fixing it right now.
Okay, thanks so much.
It's with phase one, you know?
Yeah, that's what I thought.
That's right.
Governor and Dr. Scott, Kathy Gregg here. Question. I'm starting to get phone calls and get press releases from people saying we should expose as many people as we can because that's the only way to build herd immunity. What is the response, the medical response and the leadership response to that argument?
Medical response is that is not the way we want to go right now. We are still learning about COVID-19 and the implications among people who get ill are too challenging, too concerning from a hospitalizations standpoint and unfortunate mortality standpoint. So believe me, if that was a way that we thought would be helpful, it would have been something we've considered early on, but it is not one that we, not a direction that we want to go in. We want to stay focused on testing, identifying people, and stopping transmission.
Governor, this is Ian Donis. besides speaking with all of us each day, you've done a lot of outside media appearances in the last 2 weeks, the BBC, Freakonomics Radio, Greater Boston, and Apple Podcast. When you have so much to do in responding to the crisis, why are you doing these kinds of outside media appearances?
Two reasons. One, the national media has actually been incredibly helpful. When I went on Wolf Blitzer and said we desperately needed PPE, that very night I get a phone call from the CEO of a big diagnostic company, which then led us to get equipment. So it's been very purposeful. The same thing with Salesforce. I went on another thing and said we were really desperate to be a leader with contact tracing, and then the CEO of Salesforce reached out and said, we want to help you. Microsoft has given us over 1,000 computers. So, you know, I'm always out there swinging to advocate for Rhode Island. And if I certainly turn away a lot more than I accept, you know, for every 10 opportunities, we say no to, actually for every 20, we say no to 19. But if I think there's going to be value for Rhode Island, either to highlight what we're doing or to get resources, or frankly, to get a message to the White House, then I do it.
Governor, it's Dan McGowan from the Boston Globe. Can you characterize the conversation that you had with, that you and Dr. Alexander Scott had with Deborah Birx? Were you seeking her approval in any way to reopen, or what was that conversation about?
No, actually, mostly we were asking for supplies, and I can let Nicole go over that. We just try to stay in touch with her. We were saying we wanted to roll out for her the SOS testing system that I went through yesterday, and just ask her, you know, what do you think? Is that right? What do you think in other states? Get her advice. By and large, she was very complimentary and supportive. We were then hoping she would say, what do you need? And then that provided Nicole a perfect opening to share all the supplies that we need. So it wasn't, you know, it was really just a touch base. And she was kind of supportive of what the testing we're doing. She recognized that our cases had fallen. She's been, I think I can say, and I don't want to speak for her, but like she's been worried about Rhode Island because, as she says, we're sandwiched between Boston and New York. And so she's had our eye on us because we're sandwiched between those two hotspots. And so we try to check in with her, I don't know, once a week. And then Nicole asked her for, maybe you can, you know, augment that.
Yeah, we have done a landscape of all of the testing platforms within the state, starting with the state health laboratories, and all of the testing supplies that would be needed to maximize our use of those platforms. And we have been sharing that information with her team. So I was letting her know about that data and the welcoming of any assistance with getting the supplies needed.
Can I just ask one follow-up? Did she express any frustration with, or not frustration, any concern about reopening to you?
No.
Okay.
Dr. Bartholomew, wondering about
just had a
smaller
question.
scale,
I know you kind of gave some of the
Do Brian
Okay. Yeah, Governor, I know you explained some of the rationale to keeping the limit, the gathering limit to 5 people. Some people are asking, you know, even Massachusetts has 10 people, and you've previously indicated that some of these numbers might be a little arbitrary. If you could just say more about that. And then also, if I could, on this 1 person per 300 square feet for businesses, some people are saying that's awfully limiting, and how'd you come up with that number? And you shouldn't need that much space for 1 person.
Yeah. Listen, those are all very valid questions, and this is a judgment call as much as anything else. You know, Massachusetts extended their stay-at-home order, and Connecticut extended their stay-at-home order. So I've chosen to be a bit more relaxed in lifting the stay-at-home order. We never closed manufacturing, we never closed golf courses, we never closed construction sites. They all did.
Why the 5? Because candidly, I hear from a lot of mayors who say it's a real challenge to keep the backyard barbecue, the front yard events, the big family and social gatherings. And they worried, and I agree with them, by the way, that if we allowed 10 of social gathering, all of a sudden you start to see family gatherings of 15 or 20, and I just don't think we're ready for that right now. So it's part of the take it slow, focus on work, wait and see how it goes approach. As for the 300, that is the number we're using for grocery stores when they have the senior hours. So it was felt that there was some logic to that, and it just, again, it's not a science, and I don't expect retailers will be walking around every minute with their yardstick. It's just a guide to underscore the fact that we want folks to be 6 feet apart. It's
Governor Tara Granahan.
Too, Brian, and everyone, when I was saying, we're getting to a phase where it is not going to be possible, nor do we want to be in the business of inspecting every retailer every moment to make sure they're perfectly complying with 300 square feet. It's like we are providing guidance. It's in your best interest to do your best to follow the rules, and we hope that you will.
Governor, I thought we would get a little bit more Tara Granahan if I could jump in.
Bill, you were next, and then we'll do you, Tara.
Thank you.
Doctor, when it comes to smaller assisted living facilities, that have maybe just 5 to 10 residents, are they required to reach out to you to be a participant in the testing program that you're launching, or are you eventually going to hit every assisted living facility in the state?
Our goal is to hit all of them, get to all of them in the state.
But as of right now, if they feel that they may be susceptible for any reason, they need to reach out to you. And this is, again, the smaller scale living facilities.
We are in constant communication. Certainly, if there is a case or of any kind in any of those facilities, we work that through with them. So the reach out is automatic.
Gotcha. Thank you.
Tara Granahan, if I could. Hi, Governor, were we going to get some more information about what Monday looks like? I believe Josh Block told a lot of the media managers that you'll allow reporters in a room again. How would it work, and how does the 5 to 10 or 10 to 5 play into that?
Yeah, Tara, we'll be back to you hopefully later today. We're just working out the ends of the details, and we'll let the press know as soon as we can.
It's going to be more than 5. We're trying to find a venue big enough.
Okay, thank you.
Governor, this is Kim Kalunian. Just seeking a little bit of clarification on the funerals and church service crowd limits. Does the 10 people at a funeral supersede the limit of 5 at a church service?
Yes. I'm sorry. Yes. We had a lot of discussion as recently as this morning with more faith leaders, and in recognition of the uniqueness of a funeral, it can't be rescheduled. It's a very sad time, the whole thing. We felt we had to do something, so we went up to 10.
Thanks.
Do the people in those limits include the priest or whoever's leading the service, or is it only?
No, that's for the family and such.
Okay.
Doctor, this is Michael Billow from Motif. Just to follow up on Kathy Gregg's question about herd immunity, your answer was very scientific and diplomatic, but could you speculate perhaps on what the effect of trying to relax everything and promote herd immunity would be? What I'm trying to ask is, in layman's terms, would this result in increased deaths, and is there an estimate of how many and how quickly?
Yeah, that's exactly why there would be significant concern with going that route. There unfortunately, would be quite negative outcomes, including death. As we're continuing to learn about COVID-19, we certainly know that it happens in older folks with underlying conditions, but it's also happening in other populations. So it is not a direction we feel that would be safe to go in from a public health perspective. And we still don't know about immunity for coronavirus to be able to rely on that. We are still learning, as I've shared with the antibody test, whether or not having antibodies actually means that you cannot get COVID-19 again. It is not clear right now if that's the case.
Well, what I'm getting at is that obviously the people advocating for this herd immunity approach may not understand the consequences of it. I'm trying to basically ask you to put into very direct layman's terms what you think the consequences are.
It is not safe to do. It's not something we would recommend. We don't know enough about COVID-19. It would cause significant harm at a population level.
Thank you.
Welcome.
You mentioned elective procedures in some hospitals starting Monday. What about regular dental procedures or dental appointments that are not emergencies?
We have been working closely with the dental community and providing guidance that allows them to reopen in phases. It's something that we definitely encourage, similar to our other allied health professionals, and we want to make sure they have the infection control and other guidance approaches in place to be able to do it effectively.
We've got about a minute left.
Governor, we've heard from some folks who candidly are a little exhausted by the daily briefings and wondered if you see a point where you'll go down from 7 to, maybe weekdays or whatever you just think is necessary. Have you considered yet when you'll be able to not do one 7 days a week?
Are you speaking for yourself, Ted Nisi?
You know what? I will withhold comment, but we have heard it from people. Partly, people are doing the school stuff with their kids and all that.
I'm teasing. I'm tired too. Yes, I think probably next week we're gonna cut it down to 5.
Wow. Is there any science or data that the doctor or the governor may know about that made you hold back on not going to 10 people and stick with the 5?
It's not so much science as it is, look, we know that having a lot of people in close contact is a bad thing. So it's more about human behavior. We are, because we're going first in our region with lifting the stay-at-home order, we felt, and we haven't really seen, a decline in cases in any consistent way. We felt, yet I'm anxious to get people back to work. We felt that a take it slow approach was appropriate, and one way to signal that and accomplish that was to keep the 5 at social gatherings where it was.
Do you fear there'll be any kind of pushback, like, oh man, she said 10 and now it's 5, we're still going to go get together? Is there any kind of like a reverse psychology involved here?
Truthfully, I don't know, right? Like, I've never done this before. We've never done this before. That's what I said. I'm just putting my faith and trust and confidence in the people of Rhode Island. We know that when people congregated over Passover and Easter, 2 weeks after that, we saw a spike in hospitalizations. Like, that's a fact. We know that when people get together in larger gatherings, we see a spike in hospitalizations. So I suppose if people want to break the rules and see more people in the hospital and see us move to phase 2 more slowly and see more people out of work, then they can break the rules, but I hope they don't.
Okay, thank you everyone. That's all our time today. We'll be back tomorrow.